Hi, I'm Dr. Bryan DiMarco at Renew Dental. We get a lot of questions from our patients about dental hygiene, so I'm here today to answer a few of those questions and hopefully give you a better idea about the subject of dental hygiene. Patients often ask, what is proper dental hygiene? For me, that starts with good routine at-home care, so brushing your teeth for twice a day for 2 minutes at a time, and then also flossing at nighttime before you brush your teeth. The other component of maintaining good oral hygiene is coming in to see us regularly, ideally every 6 months for a normal patient so that we can stay on top of keeping your teeth nice and clean. A few of the main things that can happen if you're not practicing good dental hygiene, the number one thing we're always worried about is gum disease. Gum disease is when you start to lose bone around your teeth. Why this is important is because that bone is the foundation for your teeth. And if we don't have good support for the teeth, then we can end up losing them over time. The other big issue is that as the bacteria build up on your teeth, and if you're not removing that regularly, then you can start to develop cavities, which is where bacteria get into your teeth and start to cause them to rot. That can become a huge issue because it can develop issues with infections and we can end up losing teeth. So we want to make sure that you can continue to chew normally and keep your teeth healthy. Patients will often ask what is involved in a dental cleaning. A dental cleaning usually consists of three main portions. So the first portion is what's called scaling. So what that involves is just removing the bacteria that's built up on your teeth. Once we've removed these deposits, we would then move on to what's called polishing. So polishing is simply removing the surface stains that have built up on your teeth so that we can keep them nice and white. The last step would be applying some fluoride. The fluoride is important because that's what actually strengthens your enamel and makes sure that it's less susceptible to getting cavities in the future. So dental hygienists have a few tools that they can use during your cleaning. The most common one is using what's called a Cavitron or an ultrasonic cleaner. So that's a little instrument that will shoot some water onto your teeth and uses a vibration to help to break up some of the deposits that are on the surface. They then will go in and use their traditional hand scaling instruments, which help them to further remove these deposits and make sure everything is nice and clean. So our goal is always that all of our patients can go through a dental cleaning almost painless, if not completely painless. We do offer many different things, such as local anesthetic or topical anesthetic to numb your gums during cleaning. Main reason that cleaning can hurt is if you haven't been in for a while and there's a lot of buildup underneath the gums. The gums tend to be inflamed, which is going to cause them to be a bit more painful. But all you need to do is let us know that it is uncomfortable, and there's many things that we can do to make it comfortable for you. So how long will a typical dental cleaning take? This really varies depending on where you yourself are starting from. So for a typical patient, if they're coming in every 6 months and we're doing a good job of maintaining things at home, typical cleaning will last about an hour, maybe 45 minutes. If you haven't been in for several years and there's a lot of buildup on your teeth, this is going to take more time for us to completely remove. Sometimes it can be a few appointments, but the good news is that once you get all caught up, and if you're coming in regularly, you too only need to come in for about 45 to an hour visits. Patients will often ask, why is a deep cleaning necessary? What a deep cleaning means is simply that we have a lot more buildup underneath the gums that we need to remove. So by removing this, we're going to reduce the risk of that disease process occurring where you start to lose bone around the teeth, which is what we call gum disease. So this typically becomes necessary if you haven't been into the dentist for a while because you simply haven't had a professional cleaning underneath your gums because that's an area that you can't reach at home. After a dental cleaning, usually it's not necessary to do any special kind of at-home care. We typically will just recommend that you avoid drinking or eating anything hot or acidic for 4 to 6 hours so that that fluoride varnish can sit on your teeth and really do its job of strengthening your enamel. If you haven't been in for a little while and your gums are tender, you could go the step of using a saltwater rinse for a couple of days or some Advil or Tylenol until that majority of inflammation has gone away, but that's usually it. So the best way for you to schedule a dental hygiene appointment would be to give our office a call, and one of our receptionists can certainly help you with scheduling that appointment. Or if you're not comfortable reaching out by phone, you can send us an email at hello@renewdentalwpg.ca. I was able to answer a few of your questions. If you do have any further questions or you are ready to take action and schedule your dental cleaning, please give us a call at 204-259-3804.